hard when I was doing other things with my shoulder that Kathy would give us balls, and the idea is instead of locking the elbows and being up here, we kind of take a breath and lengthen down, keep the elbows soft, and squeeze, put the tension here instead of up in the neck and shoulders. This is why I raise the head a little bit. All right, so as you need, you're gonna just keep the elbows soft. So this is a pet peeve of mine, the locked elbows, because it tenses everything, right? So it's just take a breath, sink your abs, exhale, and squeeze a little bit. And just feel the energy connection, almost like, sap in a tree going down into the balls, right? So that you can keep all of this relaxed. Right, so we're coming back into that. I love all these socks that I'm seeing. Somebody had socks with a little bow on them yesterday. Do you have a knee issue?
Yes.
Which one?
My left one, but it's PCL.
Oh, okay. All right. Posterior cruciate ligament. You're a rare one.
Yes.
Did you do it skiing?
No, I fell off the bicycle.
Oh. I guess it wasn't a stationary bicycle. I hope not. So did they repair it?
No.
Okay.
The doctor said that at my age, no. He said you can just do exercises.
Yeah. Okay. So we have a good candidate here, but you don't feel too atrophied in your thigh. Well, how recent is it?
4 years ago.
4 years. Okay. And did they do that drawer test and get some laxity? You know, where they keep pulling and pushing? No. No. Well, that's.
I had an MRI.
Oh. Okay.
And I had to wear the brace for 3 months.
Oh, okay. Okay, did everyone hear that? She's talking soft. All right, so this is how Carola would get into this exercise. She'd bring the knee up, and we're going vertical, but we're not coming back to this. Just, ooh, it popped already. I felt that. All right, so she's gonna flex her foot, and we're gonna keep the isometric, but now we're really working with the leg in the air and extra weight. So this is a long lever. She's gotta control this. So we're going to think about hip extension from the back of the glute, and the starting position will really be right about here. We're just checking alignments. Exhale and sink your abs. Drop this hip down a little bit. Right. So now you're going to inhale before you begin, and 6 counts to hover about this far off the mat. Exhale down. 2, 3. Push into my hand. 4, 5, 6. Stay there. Point your toe. Inhale. Exhale. Inhale and lift up. 1, 2, 3, 4, 5. About to this level. 6. Flex the foot. Now think about the back of your left glute. Press down. 2, 3. You push into me. So this is hip extension, hamstrings, right? Glutes. Now point the toe, pull up. 2, 3, 4, 5, 6. We would do 10 of these. We'll do 5. Sink your abs. 2, 3, 4, 5, 6. Point the toe, pull that belly in, and lift up. Is it getting tired yet? She's strong. She's did a lot of rehab. And push down. Push into my hand. Activate a little more here. Push, push. I don't feel a lot going on. Can you find it? That's it. There you go. And lift up. It woke up. Sometimes you really have to, you see how hands-on I am. It's the way I learned to teach. I know it's not so correct anymore, but with these atrophied muscles, it's really important. More glute, more glute. There we go. That's working. Yes. See, do one more and see if you can find that when you begin. Flex your heel. Flexing the foot will help, right? Yes, there we go. Do you feel it? It's a little different. Squeeze the balls if you need to. Yes, it's like biting down on something in your teeth with the balls. Right, there we go. That was better. That was better. You see the first 4 or 5, she hadn't even woken up the muscle that I would. Now it's working. Yes, you feel? So you have to really be patient with the brain-body connection. Yes. Okay, so let's bend the knee and bring that leg down. So we would work 10 in straight on parallel, right? And then I'm gonna just shift to the other leg so that we give it a break, but we're gonna come back to this. We're gonna do lateral hip rotation. So we're gonna bring it up and just extend it out. right, turn out, right, anchor here, sink your abs, exhale. Right, now, we're gonna work a little more here. Someone wanna come here so I don't have to reach over and block your view? Someone, come on, come close. You're gonna be my teacher, put that down. You can't video everything. Right, take your hand here, and I want, no, stay down so they can see. Can you kneel, is it too hard? All right, turn out. Right, now, you're wanting her, is she on the muscle? Well, show her where your glute is, where you want her. Right here, right here.
Yeah.
Yes, a little lower, right? It's, all right, for ladies, it's the panty line, right? Right where the butt meets, yeah. There we go. Ready? Take a breath. Stay anchored on this side. Exhale, down. Now let her push into you. Yes, yes. Don't overcross the midline. Now point the foot and keep it, right, so guess what, VMO, right? Lift, sink your abs, sink your abs, sink your abs, lift it up, up. This is harder. Flex the foot and stretch that knee, reach out. Is she pushing into your hand? Can you feel it? Right. Feel activated? And lift up. You could go a little lower. Use your belly, pull the tummy in, pull the tummy in, pull the tummy in, pull the tummy in. And flex. These are excruciating and boring, but so strengthening, right? That's it. And go a little lower. Come on. Stay anchored. Now point the toe and pull the tummy in. Lift up, lift. That's it. Right, so you get the idea. Has she done about 5? Yeah, all right. So let's rotate parallel and relax. Now this one's a little harder to turn in. We're not going to flex it quite. We're just going to leave the leg turned in. So let's go back to this leg. You can open that just a little. So I am rolling to the outside of the foot, right? And we're turning this leg in. Straight. Can you straighten? That's it. So don't roll the hip up though. So you're rotated in and you're going to go down. Right. It's a little harder to get the position correct. That's it. So we're working a little more the lateral quad. And pull the tummy in, pull the belly in. Yes! Squeeze the balls if you need to. Relax your right shoulder. Right, you see everything, as you get tired, you start using all the muscles. That's it. So it's 3 sets of 10. You can do left, right, left, right, left, right. If it's an affected leg, we're going to do more on the weak leg, right? We may not need to do the other leg at all. You know, also we're looking at the time. Are you breathing?
Yes.
Yes, okay, just check. Right, so we can inhale down, exhale up, or exhale down, inhale up. That's it, and it's slow, right? Carola would always count to 6. Don't ask me why she used 6, but it's a lot. Is it getting a little tired now? Not so much? You're pretty strong. It's pretty good. And this is the affected leg, right? Yeah, good for you. All right, so you get the idea.